Hi, I'm Sam. I'm a chiropractic student here at the University of South Wales, and today I'm going to show you around the chiropractic clinic at the university, which offers a range of services for the public. It also gives students like me the opportunity to gain hands-on experience treating and managing these patients. These patients may present to us with a range of different conditions, such as chronic low back pain or other issues with their joints or muscles. Clinical services here are overseen by registered chiropractors and delivered by student clinicians like me. These students have undergone initial training before entering a 13-month placement. As part of this placement, student clinicians carry out every aspect of patient care. Patients on their first time visiting the clinic will undergo an initial consultation. This initial consultation will give the student clinicians an opportunity to discuss and assess the issues presented, as well as taking a case history. Whilst the clinic consists of 20 treatment rooms to support the chiropractic services, the clinic also has a range of specialist suites and diagnostic units. These include a digital X-ray suite, a diagnostic ultrasound unit, DEXA scanning unit, and MRI facilities. Our DEXA scanning service offers a full body composition and bone density scan. Our ultrasound scans use high frequency sound waves to create images of internal anatomy. These services are all aimed to help diagnose, assess, and advise us on treatment options. Initial consultations that students will conduct includes a physical examination and general health check. This physical examination includes a variety of tests such as range of motion, orthopedic testing, and neurological testing. This allows us as student clinicians to build a better perspective of the patient's condition and work towards a diagnosis. Once the patient has been fully assessed and an initial consultation has been conducted, it's the student clinician's responsibility to write up and develop a case file and treatment plan. The treatment utilised by student clinicians will be bespoke for each patient, but may well include massage therapy, trigger point therapy, and manipulations. The student clinicians have been trained to confidently deliver and perform these treatments under expert supervision. Student clinicians often advise for rehab exercises to be done both at home and in the clinic. These rehab exercises help the patient to improve their function and return to a full, active life. Here we are back at the chiropractic clinic reception. I hope you've enjoyed joining me today and getting a real feel for the clinical training and services on offer. If you'd like to find out any more about the clinic or about the chiropractic degree, then please go to the university's website. Thank you for joining me, and I'll hopefully see you soon.